I didn't really think about what it would be like to be a parent with an infant with life-threatening allergies. It never came across my brain that she could have one. It took months for us to figure it out. The first time we gave her formula, she was vomiting and she was just lethargic, and it was so frightening. And I asked the pediatrician, we've had some problems feeding Scarlett, so we've given her some formula on some occasions, but she throws up. And multiple pediatricians we talked to kind of played off the symptoms as that's what babies do. But I knew that, like, in my heart, something was different. It's not just that babies vomit. It was the way she vomited. It was the fussiness she exhibited. So a couple months go by and said, I'm noticing that there's eczema. She had those weird episodes when she was really little with formula, and her sister has a tree nut allergy. Could there be something here? I was the one, as the very fortunate educated parent, to say, well, we're gonna go to an allergist. We're gonna go get her tested because something's not right. I don't know what's not right, but something's not right. And the pediatrician was supportive, of course. She said, yeah, take her to an allergist. 2 days later, we gave her soy formula, and she just starts projectile vomiting everywhere. All over me, all over her nursery. And I just remember just standing there frozen because I was like, it's happening again. So we called the pediatrician, and this is like 9 o'clock at night. The pediatrician asked me, is she hoarse? And I go, I don't know how to tell if an infant is hoarse. What does that mean? And she said, put the phone on speaker. And Scarlett started going, as soon as the pediatrician heard that sound, she goes, that is hoarseness, that's mucus. And the pediatrician said, look at her tongue. Her tongue had started to swell. And at that point, we realized, oh my God, this is full-blown anaphylaxis. We know we need to give her Auvi-Q. And the pediatrician said, absolutely. And she said, call 911. We pulled out Auvi-Q, we opened up the device. He held her, and I grabbed her leg, and I did the injection. As soon as we injected her with Auvi-Q 0.1, you could actually see epinephrine working. It was like somebody turned off a faucet. All of the symptoms stopped. The needle was in and out of her leg so fast. Pulling the device, pulling the safety guard, and the actual injection, it was so easy and made it that we could do it. We weren't scared to actually do the injection. And we're just very fortunate that on the night that Scarlett went into anaphylaxis, we were prepared. We had Auvi-Q 0.1. I believe it truly saved my daughter's life. It saved my baby's life.
What is Auvi-Q? Auvi-Q, epinephrine injection, is a prescription medicine used to treat life-threatening allergic reactions, including anaphylaxis, in adults and children who weigh 16.5 pounds or more who are at risk for or have a history of serious allergic reactions. Auvi-Q is for immediate self or caregiver administration. Important safety information. What is the most important information I should know about Auvi-Q? Always carry 2 Auvi-Q devices with you because you may not know when a life-threatening allergic reaction may happen. If a second dose of Auvi-Q is needed, it should be given starting 5 minutes after the first. If you need more than 2 doses of epinephrine for a single anaphylaxis episode, more doses must be given by a healthcare provider. Talk to your healthcare provider about when it is necessary to get medical care for further treatment of the allergic emergency after using Auvi-Q. If you have certain medical conditions or take certain medicines, your condition may get worse, or you may have more or longer-lasting side effects when you use Auvi-Q. Before using Auvi-Q, tell your healthcare provider about all of your medical conditions, especially if you have heart problems, high blood pressure, diabetes, thyroid problems, kidney problems, history of depression, Parkinson's disease, or are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal supplements. Auvi-Q and other medicines may affect each other, causing side effects. Auvi-Q may cause serious side effects. Auvi-Q should only be injected into your outer thigh, through your clothing if necessary. Do not inject Auvi-Q into your veins, buttocks, fingers, toes, hands, or feet. If this occurs, go to the nearest hospital emergency room right away and inform the healthcare provider of the location of the accidental injection. Rarely, people who use Auvi-Q may get infections at the injection site within a few days of an injection. Some of these infections can be serious. Call your healthcare provider right away if you have any of the following at an injection site: redness that does not go away, swelling, tenderness, the area feels warm to the touch. If you inject a young child or infant with Auvi-Q, hold their leg firmly in place before and during the injection to prevent injuries. Ask your healthcare provider to show you how to properly hold the leg during an injection. Common side effects of AviQ include fast, irregular, or pounding heartbeat, sweating, shakiness, headache, paleness, feelings of overexcitement, nervousness, or anxiety, weakness, dizziness, nausea and vomiting, breathing problems. Tell your healthcare provider if you have any side effect that bothers you or does not go away. These are not all of the possible side effects of AviQ. You are encouraged to report side effects to Kaleo Inc. at 1-877-302-8847 or to the FDA at www.fda.gov/medwatch or 1-800-FDA-1088.